to the Health Hub Times Square in Ballincollig, where Anneliese, our nutritional therapist, joins us. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
Lots of questions in. Let's do our best to get through as many of them as possible. Anne in Bandon was on, worried about her husband, who she thinks may have some kind of an allergy that seems to always get worse in the winter months. He gets a constant cough and his nose is constantly running all of the time, but doesn't have a high temperature, is not sick, just this cough and a runny nose. Could it be allergy related, she's wondering?
I would say very likely, I would say. And generally, I think when I hear there's a cough in the winter, I always think mould, Patricia. So a lot of people are allergic to mould and some people are highly, highly allergic to moulds. And this year particularly was quite mild and very, very wet. So I think there was an awful lot of people started to suffer a lot more this year because of the damp. And of course, damp and warm is mould. So you could probably get tested for mould allergies and that would clear it up. And then what do you do if you do have a mould allergy? So that's the difficult one. Even if you live in a house that doesn't have any obvious damp, older houses generally tend to have quite a lot of mould spores. And the only way really to get rid of them is to deal with any obvious damp and then to use air purifiers that will filter out the mould spores from the air. And they are expensive and it's worth spending money on a good one because the cheap ones, they're not going to do it. And if you're highly sensitive, you'll still be reacting. So I think Dyson do an excellent one. And what you could do is you could run it in the rooms that you spend most of your time. So maybe the kitchen or the living room and the bedroom then before bed at night. And then I'd suggest taking maybe some natural antihistamines throughout the winter. So these are applied during the summer as well. Natural antihistamines are things like quercetin, which we get from apples and onions. Also, vitamin B5 is very good. Stinging nettle is another great one, as well as a natural antihistamine and vitamin C. So you could start taking those kinds of remedies in advance of the damp months. Those natural antihistamines. And then the last thing I would recommend is Dr. Clare. She does a blend called Allertone, and it is fantastic for managing symptoms, a herbal blend, so you could take that throughout the winter months as well.
OK, Chris, could you ask Anneliese, please, what's the best to take for pains in joints? It's due to the menopause. OK, so when it's due to the menopause, Patricia, you could take natural anti-inflammatories for the joints, but actually you're not really going to probably get to the root of the problem. I'd recommend in this case HRT if you can get it from your doctor, because for a lot of women it clears it up within a week or two. If you can't get HRT, if you can't take it for any reason, we get absolutely fantastic feedback here on a couple of different products. The best one is the NutriAdvanced MegaMag. Perimenopause support is what it's called. So NutriAdvanced is the company and it's the MegaMag Perimenopause support, and that is very, very good for dealing with the hormone side of things because it's the hormones that it's the lack of estrogen that's contributing to the inflammation in the joints. If you did want to take a joint support, I'd go for an anti-inflammatory approach as opposed to a glucosamine cartilage approach. So I'd take things like let's see, bowellia is fantastic, which comes from frankincense, and also the extract of turmeric, which is called curcumin. And we've got a couple of really nice ones here in the shop. Again, NutriAdvanced is a lovely company, and they do one called Curcudyn Forte, and that one is fantastic for bringing down pain, swollen joints. OK, hiya Anneliese. Would you have any suggestions, please, for somebody who is getting constant urinary tract infections? Oh God, they can be so nasty.
They are, Patricia, and you know what? I've actually seen quite a lot of them since COVID, and actually people get them at post-vaccine, COVID vaccine as well. So I don't know if there's a kind of a relationship between the COVID virus and UTIs, but I'm seeing a lot more of them, particularly in men as well, for some strange reason. Don't know why. So the problem with UTIs is that when you take an antibiotic to clear up the UTI, it actually knocks out all the good bacteria, and it basically leaves open ground for any UTI-causing bacteria to start to colonize and grow again. So people actually find that they're in a vicious cycle of having to take an antibiotic constantly to manage symptoms of UTIs. So the best natural treatment is to repair the kidney, the health of the kidneys, and re-inoculate them with good bacteria, and then prevent the disease-causing bacteria from working. So we recommend a combination of D-mannose, which is a type of sugar. You can take that 3 times a day for treatment and once a day for prevention. We also recommend cranbiotics, which is a combination of cranberry extract and the probiotic, the good bacteria, to put them back in. And once those good bacteria are in a healthy urinary tract, they kind of colonize, Patricia, and take up all the space. So there's very little space then for the disease-causing bacteria to be able to get a foothold and grow. That D-mannose also prevents those bacteria from being able to stick on. And the third thing we recommend then is, again, Dr. Clare. She does a blend called Cystone, Cystone. And this is very good for nourishing the cells in the kidneys to keep them nice and healthy so that they can, sustain a healthy population of bacteria and repel the negative UTI-causing bacteria.
I've used that and it's excellent. It really is good.
It does work, yeah.
Okay. Hi, Anneliese. When is the best time of the year to take the Source of Life Gold Tonic?
I think any time that you feel you need it, Patricia, is the answer to that one. Now, personally, I always feel I need it around December because it's always been a very busy month, and I nearly always need to take it again around February, March. So I take a month around those times. But I know a lot of my school teacher customers take it throughout the whole winter season, so they'd start in September, they mightn't finish up until Easter because they find it really helps them get through the year without getting coughs and colds and all the sniffles that the kids get. So it's really, whenever you feel you need it yourself, you can also just buy a week's worth. So sometimes I would just, if I was feeling a bit tired, I might do a week's of it. But it is safe to take long term. It's mostly food-based. So it's very safe for people if they feel it benefits them to take it all year round, they can.
Okay, hi, question for Anneliese, please. I'm a female, early 40s, extreme tiredness. It is being monitored by the GP. Last summer I had blood work done thinking perimenopausal, but the hormone levels came back and they were all okay. But what was identified was the vitamin D was very low. So I went on a treatment course for that. Tiredness improved, but then it came back recently. Follow-up appointment showed B12 levels very low this time. Can Anneliese recommend a good all-rounder for me, please? I'm also taking escitalopram, whatever that is.
Yeah, that's what we call an SSRI, a selective serotonin reuptake inhibitor.
Okay.
So it's an antidepressant. This is a difficult one, Patricia, tiredness, because really there's so many possible causes, but the most obvious causes are low B12 and low iron. The reason you get tired if you're low in these is because they're essential as well as folate to make your blood cells. And if your blood cells can't carry oxygen around the body to your cells, you will feel exhausted because your cells need oxygen to make energy. So that's the reasoning behind that. So I think if you're low in B12 and you don't eat meat, you will need to take a supplement all year round, really. And we love the Solgar B12 nuggets because they get absorbed in the mouth. Also, NutriAdvanced, that company, they do one that gets absorbed in the mouth as well. And the reason that that's a benefit is because a lot of people lack the ability to be able to absorb B12 due to something going on in the stomach, and it tends to be genetic. So making sure it gets absorbed in the mouth bypasses that difficulty with the digestive system not being able to absorb it. So that would be one reason: low B12, low iron and low folate, low vitamin D. But then other reasons could be, even if you don't have the signs of menopause, it's possible that your hormones are imbalanced. So it could be down to that. So in that case, you'd have to work on rebalancing the hormones. And if you've got a lot of PMT symptoms like weepiness, irritability, painful breasts, painful heavy periods with clots, then it is definitely hormone balance. Stress is a big factor in tiredness as well, Patricia. So if you're kind of pumping all your resources down the stress pathway, that can make you feel exhausted, and eventually you kind of get a mini burnout, and that will make you feel tired as well. And then there is post-viral fatigue, which we've seen quite a lot of since COVID. So I'd recommend for this lady really is to go maybe work with a nutritional therapist to try and identify the root cause and work on it at that level. But a good all-rounder will be something that's very, very well absorbed. So you're looking again at the Source of Life Gold, or Oxylent is another lovely one. And you could take ginseng for a bit of an energy boost every now and then, which is great to kind of give you a non-caffeine burst of energy, and so you don't get jittery, but you get the boost.
Okay, hi Anneliese. I have shingles at the moment. Any remedies, please? I have a lot of burning pain.
Okay, So, oh yes, very painful, Patricia. Lysine probably is very good for suppressing that type and the shingles virus and also the chickenpox virus and also the herpes simplex virus. So you could take lysine every few hours. Hypericum is a homeopathic remedy that's very good for damaged nerves and inflamed nerves. So that would be another one that you'd add to it. And then we love the olive leaf extract for shingles because it's such a powerful antiviral. It's not specific to shingles, but it's just a very powerful antiviral, full stop. So take that and then make sure you're taking the usual, your vitamin C, your zinc, your vitamin D are all very important for the immune system. So a combination of those, and hopefully you'll get over it without any residual nerve problems.
Hi, Anneliese. Is there anything for restless legs? So uncomfortable, a lot of twitching in my legs.
Okay, so this probably, isn't it, Patricia, the most common one we hear really on the radio.
Sure.
So restless legs, generally combination of different causes, but the first one I think always is magnesium deficiency. So taking a magnesium supplement can help. The one that we love is the NutriAdvanced. I'm mentioning these a lot actually today, but they do have lovely products. It's called MegaMag Muscle Ease. So there's a lot of things in there besides magnesium for muscle pain and muscle cramping and restless legs. So that could be one reason. Low B12, low iron and low folate, that's another reason. So you could get those checked. And if they're low, the doctor's blood test showed that they're low, take a supplement. Sometimes it's varicose veins, Patricia calls it. So the best thing for varicose veins is hawthorn is excellent and horse chestnut. Both of those are very good for the health of veins. And you can also get horse chestnut in a cream or in a gel. Dr. Clare does a fantastic one. It's called Vina Tone, I think. And then you can also buy one in most health shops if they don't have the Dr. Clare stuff, called Vina Gel.
Okay, here's somebody who's got a cough. They've gone through 2 cough bottles. They've been on a course of antibiotics. Nothing's worked. Choked still, and sinuses are blocked.
Yeah, it's a very nasty recurrent cough that's going on this year, Patricia, and people seem to be kind of getting over the worst of it, and then it comes back a week later. So it's a nasty virus that we have this year, but we knew it was coming. So in this case here, I'd recommend the Dr. Clare, the Mucotone, which is really good, especially if there's a lot of mucus and running noses. It's great for the whole respiratory system. It's a blend of different herbs that are great for boosting the immune system because there's echinacea in there, for the inflammation that you get in the lungs and also to dry up mucus. And I'd combine that then with a good cough bottle. So the one that we love every year, but it's very hard to get at the moment, is the Comvita Winter Wellness. But Pucca do an elderberry syrup that's very good. I've used that myself for coughs. And of course, Irish Botanica do a botanical syrup one, which is lovely as well. And I think the secret of the natural cough bottles, Patricia, is rather than take them religiously 2 teaspoons 3 times a day, I actually take a sip of them or a half a teaspoon of them when I feel that I'm going to start coughing. Because if it can soothe that cough and stop you getting into those absolute fits of coughing, it prevents all of that irritation and inflammation and the sore muscles that come with coughing. And also it's exhausting coughing that much as well. So a combination of those, and again, take your combination of vitamin C, zinc and vitamin D at the same time.
Okay. Hi, Anneliese. Any advice on how to treat mouth ulcers in an 11-year-old child?
Okay, so mouth ulcers is another common one that we get, Patricia. In my experience, it's often due to being allergic to the components in toothpaste, particularly something called sodium lauryl sulfate. So switching to a natural toothpaste without sodium lauryl sulfate would work very, very well. You'll get those in any health shop. Make sure that you're asking for sodium lauryl sulfate-free toothpaste. And some of them will have fluoride. If you're worried about your kids' teeth, they will actually have fluoride in them as well. And then I think using colloidal silver to help with the healing and to take the pain out, you'll buy this in a spray in the health store. And then if generally for anything to do kind of with skin or ulcers, you take a vitamin C and zinc for skin healing. So you can buy those for an 11-year-old, suitable in a lozenge form, and they could suck on one of those a day. Okay,
and before we let you go, tell me about your Bone Health Day. It's happening this Thursday.
Yeah, so there'll be myself and another nutritional therapist who works for one of the supplement companies, Nature's Plus. We're going to be here between 11 and 1 o'clock answering people's questions about bone health. We'll be talking about some of the different supplements. The Nature's Plus one is that one that we see very good results with. So there'll be some free samples on the day as well of different products. And anybody who's any health question is welcome to come along, but it's going to be really very much focused on bone health. Okay, between 11 and 1 in Health Hub Times Square in Ballincollig. Thank you for that, Anneliese. We'll chat again next Monday. Thanks for joining us. And as always, in the afternoon, Anneliese puts up all of the topics that we've covered today as heard on the radio, and you can get that on her website, which is healthhubstore.com. And our apologies that we didn't get to all of the questions. Some of the weeks, just too many questions come in for Anneliese to answer them all. There's a couple of texts in, though, about Dallas. When we were talking with John, he's quite taken aback that Patrick Duffy, who used to play Bobby Ewing in Dallas, is to be the Grand Marshal at the Dublin Parade. Morris is in Carrigaline, and Morris says, I was born in the late 70s, loved watching Dallas. Morris says, do you know that they actually made a new Dallas a few years ago where Patrick Duffy also once again played Bobby Ewing, and JR was even in it. Unfortunately, JR passed away, and the show was then cancelled. It was on Channel 5. No, I can't say that I saw that, Morris, but Morris clearly remembers it. And on the St. Patrick's Day Parade in Dublin, Dan says, I see that the Patrick's Day Parade people in Dublin have tickets on sale for their grandstand, €250 a seat. Pity the fools who will pay for tickets just to watch a St. Patrick's Day Parade.